heard about YellowTelescope from multiple channels for years, actually. And then I was having some issues with my own coordinator. Just things weren't working. Like I would have a day full of consults and every single one of them had some fatal flaw in their whole experience where they didn't have money or they really just didn't want surgery or all of that stuff. And I realized that I was wasting my time. Also, when I was looking at her follow-up technique, I started realizing she just had a bunch of pieces of paper that she sort of handled around to remind her to follow up with people. And I was just like, this is insane. It doesn't make sense. There's no logic, there's no organization. So I knew that, my system was broken and in that I didn't have a system. And, like most plastic surgeons, I like order, I like organization and consistency. And certainly I think you guys know how to tap into that and know how to make it work for us. For one, a burden that had been lifted off of my shoulders. I have someone who's helping work with my coordinator when I can't, especially, this is something that the patients that we see, the people who come to our office, they need a lot of attention. They need a lot of input. They need a lot of information. And, we were able to get Melissa to a place where she is able to give all that information in exactly the way that I want and in a way that has been proven with the practice of other surgeons. You guys work with a lot of practices. You work with a lot of, high power practices, small practices. And I definitely appreciate and get the feel that, through everyone in the company, there is a very personalized approach, but still sort of keeping the broader picture out there. Sometimes that causes conflict. Honestly, sometimes it actually solves a lot of problems. And I think it's something that I've learned in working with you guys is you're a partner. You're not a boss. You're not a subordinate. You're a partner. And that's a really nice thing to have sort of on your shoulder as we're going through this crazy world. My numbers, I've had the 2 most profitable months of my entire career in June and July when, we really expected things to just come crashing down. I feel that there are multiple factors that went into that, but our ability to really vet and just sort of coddle the inquiries that we had was undoubtedly a big part of that. And, I feel like we're firing on all cylinders now from so many aspects of the practice, from our patient management, patient acquisition, all of that stuff. It's just working really, really well now.